Hi, I'm Emily Akins, and I'm going to be speaking to you today about our Employee Assistance Program, as well as the VA Drug-Free Workplace Program, and also our Work Life for You program. I'm sorry that I'm not meeting you all in person, but I look forward to doing that another day. So let me first tell you a little bit about our Employee Assistance Program. We are a work-based counseling program that is available to assist employees with a variety of things that may be going on in your lives. These can be anything from stuff that's happening at home and stuff that's happening at work, and the slide shows you some of the typical things that we see. We're short-term, we're solution-focused, and it doesn't cost you anything to use the Employee Assistance Program. So just keep in mind that you don't have to come for a work-related issue. It can also be a personal issue. And of course, with everything going on right now in the world, there's a lot of stress and anxiety out there, and we're happy to help you address that or look at ways to kind of cope with all this stuff going on with COVID-19 as well. So let me say a couple of important things too about our program. So we're confidential. That's one of the most important things that I want to get across. When you come and see us, you're talking just to us. We keep our notes separate from anything that would be going into the patient records. Nothing leaves our office. Really, it all stays within the office. All of your records are kept securely with us. We dispose of them at the correct time, and they're locked up, and nothing is in the computer, so that you know that. You can come up to 8 hours without charge to your leave to see us. That is tracked informally, so you don't need to worry about putting in authorized absence or anything like that. You'll just let your supervisor know you'd like to come over. We know you're coming, you know we're coming, and so we sort of track it that way. Rarely do we have any issues with supervisors worrying about that or wondering about it, but do give them a heads up if you're coming during your work time. And I'll just say here too, if you're not comfortable coming during work, it's okay to come on your own time. Like you could take annual leave or sick leave, or you can come before or after your tour on your lunch if you want to. Not everybody will see us for 8 visits or for 8 hours. Some people only need to come once and kind of get something off their chest and do some problem solving, and then they're on their way, and other people maybe want to come a little bit more frequently. So we'll just kind of match that to whatever it is that you need. If we make referrals for you outside of the EAP, then you're utilizing your own insurance, so you'll be responsible for cost at that point. And then I'll also say here, you don't have to come and see us ever. Your supervisor might recommend it, might want you to come over, but you don't have to. It's an option for you if you want to use it. And if you'd rather just go see someone in the community to start with, then you have that option as well. And if you just want some ideas of where to go with that, you can just give us a call and we'll try to point you in the right direction. It's easy to reach us. Just remember extension 1700. You can also email us, Emily Akins, AIKINS at va.gov, or my coworker Tim, who's also a social worker, Tim Carr, Timothy.Carr at va.gov. So you can find us either of those ways. If you are going to be working in one of the outlying CBOCs like West Valley and Salt Lake City, we cover here under our EAP, but if you're like at Pocatello or Ogden or Orem or St. George or another one that's far away, we've got a sharing agreement, an interagency agreement actually in place with an agency called Federal Occupational Health that will give you your EAP benefits. So the number that you would call if you're in one of those outlying clinics is here on the screen. It's 1-800-222-0364. If you run into any issues or you forget that number, you can also call us at extension 1700. Okay, in addition to our normal EAP roles, which is providing counseling to VA employees, we also do some other things. Sometimes supervisors will reach out to us for some consultation around a difficult case. We can also outreach to employees that we know have been dealing with something particularly hard, maybe a disruptive workplace situation or something like that. We also have a team called the Critical Event Response Team that is available to go to work sites who have experienced an unusual amount of stress. Maybe there was a staff death or something really tragic and unusual that happened. We can implement that team to come out to work with staff at the team level. We also do some training and education and try to get offerings out. That this is all a little bit changed with everything going on, but we're trying to still provide some things virtually. We could also do some conflict resolution when employees are having trouble getting along with each other, We don't do formal ADR or alternative dispute resolution mediation, but we can do just kind of getting two people together to talk things out. And then we also do some team building. So sometimes supervisors will contact us when there are issues going on within a team. And team building can be something simple and fun, like during a team retreat, or it can be something more complicated when there's some just dysfunctional team dynamics. So just know that you may see us in these various ways. Okay. And like I said, all of this stuff is kind of different right now with everything going on. So we're doing our best to be available to all the changing demands that we have. I do want to impress upon you this piece. If you're in a crisis, remember the national crisis line number. People seem to think or tend to think that only veterans can use this number because we push it so hard with our veterans, which is good, but anybody can call this number actually. So if you're in crisis, having thoughts of harming yourself, please call this number and get connected. And this number is available to you 24/7. So that's why I want to just stress that it's a good number for you to call. Don't hesitate to use it if you need it. Then the other thing I'll say is if you're worried about a coworker, you might have heard them say something that's alarming to you, something that makes you think they're thinking about hurting themselves. Please ask them, like, don't just ignore it. It's okay to sort of say something like, hey, I'm worried about you. You said this thing and it sort of seemed funny. What did you mean by that? Are you okay? Are you thinking of hurting yourself? It's okay to ask these questions and let them know that you're worried. And dig a little bit deeper. So speak up if you're concerned that somebody is at risk of hurting themselves, and know the resources. So again, we have the National Crisis Line. You can also call EAP, and anybody, anytime, can also call 911 or ask for a welfare check for somebody else that they're concerned about. And also people can go to their local emergency room for evaluation. So just know that the resources are there, not just for our veteran patients that we're seeing, but for all of us and our coworkers. Okay. So normally I'd ask if there were any questions, but that's what's different about this and not being able to be with you all in person. So if you have questions, get in touch with us. Call us at extension 1700, and we're happy to address those questions. The next thing I'm going to talk to you about is our drug-free workplace program. So some of you will have already done some pre-employment drug testing, so you're not unfamiliar with this, but need to let you know about a few things. Essentially that it's been around for quite a while, a condition of federal employment that employees refrain from using illegal drugs on or off duty. So you need to understand that. In terms of how people use and what we kind of want to look for in the workplace, and alcohol and drugs, it gets a little bit confusing because alcohol is not illegal and drugs are, but we still have to come to work ready, willing, and able to work. So hear that piece of it, whether you might even be prescribed a medication that's legal and you're taking it as you should, but you need to understand how that medication affects you. But let me back up and just talk a little bit about how people tend to use when there might be a problem with an addiction. So normal use, of course, is using a substance in a way that is, one, legal, and it doesn't pose a risk of harm to you or anybody else. Okay, so that might be having a beer in the afternoon at home in your own backyard, or having a glass of wine with dinner, not drinking so much that your driving's impaired or that you may make poor choices. Okay. When we abuse something, we're using it in a way to alter our mood or mindset, and potentially in a way that poses risk of harm to other people. And that's something we actually need to pay really close attention to right now with COVID-19, is just how are people coping, and are they home more and drinking more and using that as a coping resource. So pay attention to that, and if you feel like something's getting out of control, get in touch with us so we can talk with you about it and work out a plan before it gets out of hand. Now, addiction is a little bit different than that even. It's using a substance compulsively and in a way that does pose physical and psychological or other social harm. Despite knowing these negative consequences, when someone's addicted, they continue to use that way. So just kind of understand that framework in terms of use. When people have addiction, there's two ways they're addicted. They're addicted both physically, meaning they're adapted to that substance and sort of need that on board to feel normal, to feel well. They can go into withdrawal if they don't have that. and the psychological dependence, which is something I think we all have to some degree, that is feeling like I need this thing. And when I say we all have that, what I mean to say is like sometimes people have like, I need some chocolate in the afternoon, or I need some Diet Coke, or whatever it may be. We can all relate to the idea of psychological dependence, like sort of seeking something out routinely, wanting that thing. But the same thing, of course, happens with substances that can become dangerous and complicates how do you kind of quit doing this thing that you feel you need. We know addiction is also chronic. Even if people stop using for a time, the disease typically doesn't go away. So in other words, if you quit using, it doesn't mean you're cured, and then you can go back and pick up. It's progressive when use continues. So if you were to stop for a while and pick up, it usually gets worse over time. Okay. It's also primary. It becomes an illness or something that needs to be treated all on its own, despite other things that may be going on with it, and it can be terminal. It causes all kinds of damage to your body, and it's just a hard way to live and to continue. So just be aware of that as well. There's lots of good reasons to kind of get this under control or to get some help for it. So the VA does different types of drug testing. There's pre-employment drug testing, which I mentioned before. Some of you will have already had. There's also random drug testing and reasonable suspicion drug testing. So let me just back up here. Random drug testing is going to happen when names are randomly set down to our HR director, and they correspond with an employee. A number maybe is sent down that corresponds to an employee, and that employee then is directed to report for random drug testing, like immediately. So that's how that part happens. It's not like your name's picked out of a hat here locally, but I believe our HR director is told this is who you will pick. So that's the random part. And the reasonable suspicion testing is when you seem to be impaired at work, then there's a process to implement reasonable suspicion drug testing, okay? And that would mean that your supervisor and another supervisor have to say, yeah, this person seems like a little off today, a little bit weird. We are concerned about them. Are they safe to be here? They'll get in touch with HR. HR will kind of guide them through the process, but it will require that you go to employee health, that you just get assessed if there's anything else happening. Then you're sent to the lab to do some drug testing, and it's kind of taken from there. So questions people have usually at this point is, well, what if I am prescribed something legally? That's going to show up. Maybe I take something for anxiety. Well, all you have to do then is provide your valid prescription during that process, or immediately following that process, to show that if you have this thing in your body, that it's okay, you were prescribed that thing. But like I said before, if your behavior seemed off, that's still a concern. You maybe are supposed to take that medicine, but if your behavior, you're slurring your words, or you seem unsteady, or you might have trouble with decision making, that type of thing, we still need to be concerned about that. Are you safe to be here? Is it a good idea for you to be here right now? So that stuff may still have to be looked at. It's just that you wouldn't be in trouble necessarily for that, but something that has to be addressed later. So let me just stress again, employer responsibility. Every employee is expected to abide by the drug-free workplace policy, not use illegal drugs on or off duty, not have on-duty impairment. So if you're worried about that, it's better to, let's say that you were prescribed something you've never used before. Try that on the weekend and see how you feel before you come to work, or when you're not scheduled to work. Try that out first and sort of know how that affects you before you come in with that on board. And the same goes true even with over-the-counter medication. Sometimes people take, NyQuil or Dayquil or something, and it makes them feel weird. So just be aware that you need to come to work ready, willing, and able to work. I was going to say too, the other question people often have is, what about marijuana or THC? Because it is so widely available now throughout the country. It's legal in different places, but it isn't legal federally. It isn't legal recreationally for you as a VA employee to use. So you need to be very careful about that. And I would add even different products that are available that are not regulated may contain trace amounts of THC, and so you have to be careful about using the CBD oils and candies and that type of thing, because those can show up positive in a drug test. So be aware of that. Okay, so if you are sent for drug testing, you need to fully cooperate. But I do want to stress again, if you think you have a problem, like come and talk with the EAP first, where it's confidential, and we can help you at least sort of problem solve. What do you want to do with this? Okay, and let me tell you about Safe Harbor as an option too. While the federal government is saying it's a condition of federal employment that you're not using illegal drugs on or off duty, it also recognizes some people may come into the workforce with a problem or a history of a problem or develop a problem while they're working. So the Safe Harbor program is a provision of the Drug-Free Workplace program that says if you come forward prior to the problem being identified some other way, then you will not be in trouble. There won't be any adverse action taken against you so long as you get help for that problem and then you refrain from using the illegal substance or any illegal substances after that. So what would essentially happen then is an employee would come forward to their supervisor or to HR and say, I want to do Safe Harbor. And there's a formal process then. HR writes up a letter. You're going to be referred to EAP then, and we're going to help make sure you get into treatment and that you're doing okay. When you complete treatment, you get referred back to HR, and they will do random drug testing. So you want to make sure you're able to fully comply with that program if you decide to go this Safe Harbor route, but know that that's an option, okay? Again, if you come to the Employee Assistance Program, that part's confidential, okay? Again, if you have questions, please call us at extension 1700 because I know all this stuff's kind of confusing. It can get confusing, but that conversation's confidential, and come and talk to us before things get worse. Okay, so the next thing I'm going to talk to you about is our Work Life for You program. This is a nice kind of addition to the counseling services that are provided. It's essentially here, the overview slide tells you there are experts and tips and resources and things available to you 24/7, and actually all of your household members to help with things like child care and parenting, adult care and aging, education and career development, health and wellness, daily life needs, and a lot of other stuff, frankly. So it's a pretty nice program if you've got something you're trying to juggle at home or questions about something or a resource. They can help you. So here's an example with the child care and parenting, all these different things that might come up. And of course, again, with everything happening right now with COVID-19, it's extra complicated. And this program might be even more helpful, kind of depending upon what your needs are. So all kinds of different ways they help with child care and parenting that you can see here on the slide. Adult care and aging as well. Here's another one where this can be a stressor for employees, and so they can kind of help take some of that stress off your plate by doing a little bit of research for you. They even do some in-home assessments, elder care assessments, which can be really nice if you're concerned about your aging parents or loved ones. And that comes here kind of with the professional care management, in these in-person assessments. Also with education, if you're looking at going back to school or you have maybe kids that are getting ready for school, they can help do some research for you around, colleges or scholarships or financial aid or different things that might help you. And it even says, kindergarten and tutoring and special needs. So kind of anything under that education umbrella is something that they may be able to help with. They also have a lot of tips and resources on health and wellness. They'll do different webinars. They have different tip sheets if you're trying to lose weight or get in shape. This is a great resource to check out. And then daily life stuff. So this is one piece that I really like. Let's imagine that you woke up tomorrow and you had a pipe leak in your basement. Something broke and you've got a flood now in your laundry room. So in theory, you could call Work Life for You and say, hey, I had this happen. And they will research 3 plumbers that are available to come to your house that day. And the idea is that you can get to work while they do that looking around. And I say in theory because hopefully you've already got a plumber that you can call who will run right over. But if you didn't or you couldn't reach that person, Work Life for You might be able to help. And they'll do that with a lot of other stuff, setting up pet care, travel plans, relocating, etc. In addition, they offer these various Work Life for You kits. This particular slide may not be completely accurate with all the different kits they're offering right now, but if you're going through some kind of life-changing event, maybe you're caring for elderly parents, or your kids are going away to college or something, you can call and request one of these kits and they'll send it to you at no charge. They've also got a great website, so you can get on there and kind of play around and see what's available with the different webinars and tips and things that they have. And so I'd encourage you to check that out too. So now what's interesting is that this is the same agency that provides the EAP to our outlying CBOCs. So you recognize this number maybe, the 1-800-222-0364 here on the screen. So feel free to call them. You have a registration code that you'll need to put in if you call. If you call them, give that to them, or if you go online and register. So the main campus, West Valley, Salt Lake City, well, the vet center we don't really cover anymore, so I apologize that that's on there. But the registration code is VASLC. For everyone else, it's VAUT. Okay. If you run into any issues trying to get that set up, give us a call. Sometimes there's areas of confusion because VHA nationally used to use WorkLife4You a few years ago and then stopped doing it. Some sites kept it, and Salt Lake was one of them. But what happens is people call into that number, and the person at the call center will say, well, we don't do anything for VA, because they're kind of looking at that old information. And despite our attempts to re-educate them, that just comes up every now and then. So if you run into that, get in touch with us at extension 1700, and we'll make sure you get linked with WorkLife4You. Okay, so welcome to the VA. And again, if you have questions about anything that I've been over, I hope you won't hesitate to contact me or my coworker. You can reach us both through extension 1700. And welcome, and we look forward to hopefully seeing you in person sometime in the near future. Thanks.